If you're going to apply to the Doctor of Physical Therapy program, you would need to first have taken a list of prerequisite courses, and those include, the sciences, chemistry, biology, physics. So we want to make sure that people have a good foundation that we can build upon in the DPT program.
College of St. Mary's Doctor of Physical Therapy program is what we call a blended learning program. So essentially what that is we have students from all over the country.
So part of our accreditation process is that we must demonstrate that our students who are online have the same access as our students who are in person, face-to-face. So student services that typically have access to in a residential model, you're going to have access to that virtually.
All of our resources are online, and we have two 16-week clinical experiences after the student has done the didactic coursework.
I would say amazing things about our program is that we're interdisciplinary. So we have a physical therapist who's also an occupational therapist. That's Dr. Andrea Kessler. We have Dr. Heather Cahoot, who's a physician assistant teaching in a DPT program. The rest of the faculty we're PTs, but we also have very different areas of specialty practice.
We were recruited across the country, so we have the best and the brightest and most experienced faculty across the country. We currently have 9 full-time faculty that are very diverse and very experienced.
So with our faculty, I would say close to 50 to 60% of our faculty are board certified clinical specialists, and they've obtained residency certification. So they've gone through a residency or fellowship program. That is so rare and unique in physical therapy education.
We are very driven to find compassionate and very caring students from medically underserved areas.
Our program has these different threads that go through them. One thread is our social determinants of health thread. There are certain populations of patients that don't really receive equal care. And so we teach our students that when you're treating patients, it's not just about treating a disorder or treating an impairment. It's about finding out what has contributed to the reason why that patient is in front of you in the first place. The mission of the program is that we prepare competent physical therapists who can treat a diverse patient population and a medically underserved population.
So there are plenty of places in the country that have that don't have enough physical therapists and other health professionals. And we hope that our students that come from small rural communities can go back then to serve their communities where they're most needed.